Good morning, everyone. Thank you for joining us. We'll get started a couple minutes early. We appreciate you joining us for this virtual press briefing in Itasca County. My name is Kelly Chandler. I'm the Public Health Division Manager for Itasca County. We've been hosting press briefings every other Thursday to address COVID-19 related issues and questions. And today we will discuss COVID-19 vaccinations. We will discuss the phased rollout in Itasca and Minnesota, the safety of the vaccine, and here's some personal experience on why receiving the vaccine is important. Our speakers include Kristen Lin, Essentia Health Regional Director of Nursing, Ken Decoster, Assistant Principal, Special Services, Independent School District 318, Adam Pavick, Pharmacy Director for Itasca Medical Care, and Dr. Dan Suller, Vice President of Medical Affairs and Family Physician, Grand Itasca Clinic and Hospital. As always, after our speakers, we will host a question and answer session with the media, and we'll ask our panelists to respond. We are very excited to have vaccines available for COVID-19. And again, currently the vaccine is rolling out in phases based on where you work or where you live. Minnesota has initially prioritized groups that are at a higher risk of contracting COVID-19 or spreading COVID-19, or if you're at a higher risk of potentially negative outcomes if you were to be infected with COVID-19. The Itasca County rollout is finalizing phase 1A in the next 1 to 2 weeks. Our hospitals, our emergency medical service workers, skilled nursing facilities have all received their first dose, and in some cases, even their second dose of their vaccination. Our assisted livings will all have 1 dose for residents and staff by early next week. And our healthcare workers that are not affiliated with a larger healthcare system will receive dose 1 by next week. This group includes our home healthcare workers, our dental office staff, funeral home staff, some of our behavioral chemical health workers, group homes, adult foster care providers. We are on administer dose 1 again with our partners by next week. Our 3 healthcare systems have all been educating the public on the vaccine. All 3 have a frequently asked questions section regarding the vaccine on their website. Essentia Health has a webinar planned for this Friday, which is tomorrow from 12 to 1 regarding the vaccine. Grand Itasca Clinic and Hospital has 2 virtual information sessions available. One is airing on ICTV and one is on their website and social media. And that one includes a panel of providers. Vaccinating is very much a personal decision, and we strongly encourage everyone to do their research with their healthcare providers. So when it's your turn, when it's your time to receive the vaccine, that you are making the best decision for yourself and your family. In Itasca, we have for vaccine delivery for weeks and even months, and we are ready to administer when the vaccines are available. We are meeting weekly with hospitals, clinics, and pharmacies who are all a part of the vaccine delivery team to best administer to our Itasca County residents, regardless of where you live throughout the entire county. The next round of vaccines shifted a bit this past week in Minnesota and actually nationally as well. The next priority group, which is considered phase 1B, will be the over 65 population, and then our school staff and our childcare providers. Currently, vaccines are not widely available for this group in Minnesota. When vaccines are available, you will be the next group. We just don't have access to them at this time. In the meantime, again, as we previously mentioned, educate yourself, do your research so you can make the best informed decision for yourself on receiving the vaccine. If you do not have a healthcare provider, now is a perfect time to establish with a healthcare provider, enroll in the electronic systems that our hospitals and clinics have available, including My Health and My Chart. These will be some of the primary manners that your healthcare providers will reach out to you when it's your turn for the vaccine. We're also going to provide these every other week updates on when your vaccine's available. We have our twice weekly written media releases, and we will be providing vaccine information in those. And then some healthcare systems use text, they use automated phone messages, and even written letters to inform you of when it's your turn for the vaccine. Before I introduce our speakers, I want to talk briefly on our COVID numbers in Itasca. They are really looking good. They've been on a steady decline since the beginning of December and beginning of New Year. We've had a few blips here and there, with some increased cases, but overall we're looking pretty good, much better than we were looking in the fall. In the past 7 days, we've identified 38 new COVID-19 cases. In the past 14 days, we've had 104 new cases identified. Sadly, we have had another death this past week, and it is a male in their 30s. And we offer our condolences to the family and friends of all those who have passed from COVID. Our 14-day COVID-19 rate per 1,000 is 21 as of January 18th, and we've held in the 20s since the beginning of January. We thank you again to our Itasca County neighbors for doing your part, and you're staying strong and staying the course as we move to this next phase in the COVID-19 global pandemic. I will now introduce our first speaker, Kristen Lin, Regional Director of Nursing, Essentia Health.
Hello. I would like to start by saying I'm very excited that the vaccines are here. I think that this is the best hope for ending this pandemic. Like Kelly said, I had to do some research before I decided the vaccine was right for me, and I would encourage everyone to do that. It's kind of like buying a car. You do a little research before you make the decision. After doing the research, I have full confidence in the safety of the vaccine, and I'm definitely encouraging my friends and family to get the vaccine when it's available to them. The important part of getting the vaccine is achieving herd immunity. This means that each of us have to make a choice, but then together can decrease the ability of the virus to spread, creating a safer community and protecting the most vulnerable people out there. In the last 9 months, maybe it's been more like 10 or 12 months now, it feels like it's been a long time, I've learned a lot about COVID, and most importantly is that it's a real thing. The people out there that are getting sick with COVID are getting very sick, and it's a different kind of sickness than I've ever seen before. We've had moments where we've been exhausted and we felt like we've completely exhausted our resources. And what we had it wasn't enough. This is a situation I don't want to be in again, a situation where the needs of the patients outweigh the ability of the entire state's healthcare system. It's an incredibly helpless feeling as a medical provider to know, that your entire state's resources are maxed. So I'm looking forward to being able to provide vaccines on a more broad scale, providing a higher level of protection to the communities that we serve. Essentia Health is following guidelines from the Minnesota Department of Health that determines, kind of the priority level and the number of vaccines available in each area. I won't be able to stay on for the whole call here because I have to go start getting organized for our mass vaccine space that we're getting set up to hopefully be able to utilize in the very near future. For more vaccine updates from Essentia Health, you can go to the Essentia Health website and click on vaccine distribution on the top of the page. And that's my message.
Thank you, Kristen. And our next speaker is Ken Decoster, Assistant Principal of Special Services, Independent School District 318.
Good morning. Thank you for having me. Was asked to come and speak on a little bit about school district things, but I'm in a unique situation of already having had the opportunity to receive the vaccine, not as an administrator or an educator, but as a firefighter, emergency medical responder on an area fire department in the county. When I got the opportunity to receive the vaccine, I certainly, as Kelly and Kristen have both said, it's a very personal decision, and certainly gave that some good thought, did my research. And for me, I wanted to do it not only to be able to continue to provide that service as a firefighter, emergency medical responder, but working in the school district and seeing students every day, and being part of the adjustments that have to be made due to the COVID-19 pandemic, and watching how our students are being affected by that. That probably weighed the most heavily on me, really wanting our students, and I have 2 kids of my own, and wanting all of our students to have the opportunities that they've been able to have in the past, whether that would be in-person learning every single day or extracurricular activities, or other activities even outside of school. That's been something I see on a daily basis. And as I went through that decision-making process of, do I want to do the vaccine? It weighed heavily on me wanting to do my part to keep our numbers low in our county, wanting to make sure that our schools can be staffed adequately, and that our students can return to in-person learning if the families make that decision and do so in a healthy way and get those opportunities that have been restricted because of COVID-19. So really, that was my decision process. That was what went into my personal decision for that. I can say that when I went in to get my first round of the vaccine, public health officials were fantastic. They made it easy. The process was very, I think it was a very positive one for me. Everybody responds differently. I happened to be on vacation that day. I got the vaccine at noon. I was ice fishing that afternoon. I could feel a little tenderness in my shoulder the next day. Other than that, I was very lucky not to have any other noticeable side effects at all. And I've been happy to have gone through the process, and happy to be here today to share it.
Thank you. We will now hear from Adam Pavick, Pharmacy Director, Itasca Medical Care.
Thanks, Kelly, and good morning. I was asked to talk briefly about some of the safety concerns that some of our community members have brought up regarding the vaccine. So first and foremost, are the vaccines considered safe? Right now, the vaccines are considered safe. None of the vaccine trials have reported any serious safety concerns. There are some frequent common side effects, which include pain at the injection site, fever, muscle aches, fatigue, and headaches, mostly lasting a day or two. If symptoms persist longer than that, we're instructing patients to seek guidance from their doctor. Again, side effects can be similar to COVID symptoms, but rest assured, you cannot get COVID from the vaccine. If you have allergies, especially severe ones that require you to carry an EpiPen, discuss the COVID-19 vaccine with your doctor. So in looking at and having discussions to community members of whether they've done their research and have made a decision about receiving the vaccine, I've heard a couple trends and common perspectives or questions and concerns that have come up. Three of them really have rang consistent. So first is I don't trust the safety of the vaccine because the process was rushed. Second, I heard the vaccine makes people sick. And third, I don't trust the safety of the vaccine because I heard it can change your DNA. So I wanted to address those three briefly. So first, I'll start with addressing the speed of the approval of the vaccine. So people are saying, I'm not sure I'm going to get the vaccine because it's too new and it seemed to happen too fast. Indeed, the approval process was fast. COVID vaccines were developed quickly thanks to Operation Warp Speed. So Operation Warp Speed ensured swift vaccine development, which included careful testing, a fast authorization process for emergency use, and continuous monitoring for safety, problems, and side effects. So with careful testing, all the vaccines that have been authorized for emergency use as of today go through 4 phases of clinical trial tests. First, testing safety, and then second, testing effectiveness. The fast authorization process for emergency use is probably the main concern that I've seen, and it's an interesting concern and perception of a problem when the COVID vaccines that meet FDA safety and effectiveness standards are made available through the use, which is an approval process that is much faster. Typically, drugs and vaccines are approved in around a 4-year time period. The FDA typically requires vaccine makers to complete a stepped approach and to submit all 4 phases of their data at once, which is a much slower process. And for the COVID vaccine, the FDA and manufacturers work together simultaneously to gather safety and effectiveness data and review the data continuously through each phase of development to get them authorized by the FDA quickly without skipping any safety steps. And then lastly, the important part is these trials were conducted in a warp speed fashion, but they're also continuously being monitored. They're continuous studies, they're ongoing. So once a vaccine is authorized for use, monitoring continues to track problems and side effects that may have not been detected during clinical trials. So if there are problems with the vaccine, they're most likely to be caught early and addressed quickly. So that's a little bit about the speed of the vaccine and some of the concerns that folks have. The other thing I've heard is it makes people sick. Well, the side effects are similar to COVID. And again, rest assured, it is not COVID. The most common side effects, like one of our previous speakers mentioned, is a sore arm. The other is fever and fatigue, which happen most frequently after the second dose. You can treat those side effects with common over-the-counter medications such as ibuprofen or Tylenol. Some patients may be allergic to the vaccine. In clinical trials, the incidence was 1 in about 100,000 patients had an allergic reaction. Therefore, patients are monitored after the shot is administered for at least 15 minutes and longer in cases where patients have a medical condition that could lead to a severe allergic reaction. The CDC says people with allergies to certain foods, insects, latex, and other common allergens can have the COVID vaccine. The only patients that should not receive the vaccine or anyone who's had a severe allergy to any of the vaccine ingredients. And then lastly, I wanted to touch base on one of the concerns I've heard is I don't trust the safety of the vaccine because I've heard it can change your DNA. And so really this is about the newness of the technology used for the COVID-19 vaccines using mRNA technology. So the concern of it's going to alter my DNA is this is simply not true. The vaccine doesn't touch your DNA. The currently approved vaccines use mRNA, which is different than your body's DNA, to instruct your cells to make a COVID virus particle that allows your body to build immunity against the actual virus. Unlike most other vaccines, the COVID vaccines don't use an actual virus that are alive to build immunity. So that's a key differentiator and something that I've heard individuals being concerned with around the newness of the vaccine. And those are the things I've heard that as people are doing their research and deciding on whether or not to receive the vaccine, that I think giving them more information will help them make their choice.
Thanks, Adam. And we will now hear from Dr. Dan Suller, Vice President of Medical Affairs and Family Physician, Grand Itasca Clinic and Hospital.
Hey, good morning, Kelly. Thanks for having me on today. Appreciate being part of this panel. So I just want to touch about a few things similar to what Adam did. In clinic, I'm getting a lot of questions about the vaccine and quite frankly, bringing it up with every patient just because it is the elephant in the room right now as we're going through this COVID pandemic. So I want to touch on a few of the common questions I'm hearing myself in clinic from my patients. One question I get a lot is about this herd immunity. And really herd immunity, what that means is the capability of the community in general to be immune to a particular disease. And most experts feel we have to have about 70% immunity for this disease to start going away and returning to a sense of normalcy. There's two ways you can get immune to COVID. One is by naturally getting the disease, which lasts probably about 90 days on average, most experts think. So after about 3 months, your immunity to COVID goes away. You may have heard on the news about some folks getting COVID a second or even a third time down the road. And so natural immunity is very short-lived. The other downside of natural immunity is, of course, there's a large amount of folks that end up in the hospital. And unfortunately, we've now got over 400,000 Americans that have died from herd immunity, from natural immunity or natural disease. And so the other way to develop herd immunity is through immunizations. And as Adam said, these immunizations have been studied. The technology has been around since the 80s. These particular vaccines have been studied thoroughly, no different than other vaccines, just quicker. And, so far the safety is well known and is very safe. The effectiveness is 95% effective for the two vaccines that are out there. And, the death rate is 0. Nobody has died from these vaccines. So I think that's a very stark contrast from getting this disease naturally. A second question Adam touched on that I get a lot is allergies, seasonal allergies, food allergies, medication allergies. And I would agree with Adam. These vaccines have been tested in folks in those categories and is very safe. I would hesitate if somebody's had a history of an anaphylactic reaction or had used an EpiPen in the past. So we do acknowledge that. That is rare, but that is the one group with allergies that I would have hold off for now until more data is available. Two other questions we get commonly is what to do for women that are childbearing age, pregnant or breastfeeding. And there's two large groups in the United States of obstetricians and gynecologists, as well as maternal fetal medicine specialists, that both agree that women in those categories should be offered the vaccine when their priority group is up. So the quick answer is if you fall in those categories, you should definitely be offered that vaccine. I always encourage patients to have that conversation at a more thorough level with their provider if there's more questions. And then finally, I just want to touch on immunocompromised folks. We are recommending that if you are immunocompromised or have a weakened immune system, that you do get the vaccine. Clearly, folks in that category that get COVID are at higher risk of severe disease, hospitalizations, and death. And again, these vaccines have been studied in those populations. And so we certainly recommend if you fall in those categories of having a weakened immune system, it's all the more reason you should go through with getting your COVID vaccine when it is available for you. With that, I'll stop and turn it back over to Kelly.
Thank you. We're now going to move into the question and answer portion of our press briefing. Media, please state your name and your organization you work for in the chat box along with your questions, and we will turn it over to any panelists that are appropriate for the Kathy Lin, KOZY, we're hearing that school districts like Mountain Iron are getting just 4 doses. As we move into phase 1B, are we going to have access to enough doses? I will actually address that one eventually, although it'll take weeks and months. Everyone who would like to have a vaccine will have access to it. It's just going to take us a while to get there. Great question on these special COVID doses at 9 sites set up around the state of Minnesota. These are being operated by the state of Minnesota, less local involvement than our typical vaccine planning. So what's happened is half of these doses are for the 65 and older population, and half of them are for school districts and childcare. And in the Northeast region, our regional site is Mountain Iron, and our local school districts are receiving an allocation of vaccine. I'm hearing different reports, but it sounds like they will receive dose number 1, our school districts, for at least 2 weeks in a row. I've heard 3 weeks as well, but I'm pretty sure it's 2 for sure. So Grand Rapids School District is receiving 20 of those doses per week. And then Greenway, Nashwauk, and Deer River are receiving between 5 and 8 doses per week. And then our Investorly Childcare is also receiving an allotment. Yes, eventually we will have enough. What we don't know is it going to be over 65 that we do first? Is it going to be schools and childcare that we do first, or will it be a mixture like the state is doing? So a few unknowns. But yes, eventually we will have enough when it's time for 1B. Jennifer from ICTV, Dr. Suller, what do you say to those out there who argue the COVID vaccine is just like the flu vaccine? The virus has already mutated, and this vaccine will be just like the flu vaccine.
Yeah, so that's a conversation we have frequently, and my argument back would be that influenza and COVID while they are similar, that they are viruses, they are very different in many ways. And the viruses in general mutate and have changes frequently. That's just the way viruses operate and work. What we do know is that the changes that we see that's been reported out of Britain, and there's actually numerous variants in the United States, that the vaccine will be effective against all of those variants. Viruses just simply don't change quick enough to be able to elude the immunization, the antibodies we develop from these immunizations. And so the other piece I would argue, back to a patient that brought that up, is, in our best years, the flu vaccine is probably 60% effective. And again, we have very good data that shows this vaccine is 95% effective. So we are in a critical time right now to get on top of this. The feeling is, if we can achieve herd immunity, over the coming months, there is the very good potential for this to simply just kind of go away. If we do not achieve adequate herd immunity, then COVID potentially has the ability to become more of a seasonal infection, which of course none of us want to go through this next year. So it is critical, and there is very distinct differences from the flu vaccine.
Britta Arendt from Herald Review. If you're immune compromised, do you talk with your doctor or call a medical facility to request to be on the list for the vaccine? I believe Kristen had to jump off, and so I will turn this one to Dr. Suller to answer.
Yeah, so that's a great question. And we at Grand Itasca are getting dozens of these calls every day. And I know Essentia and Big Fork are experiencing similar. Right now, our recommendation is to make sure that you folks are signed up to our electronic portal. That will be the quickest way we can get lists and information out to people in certain categories, whether it's based on age, whether it's based on your medical condition. So when we have vaccine available, our plan is to send out that blast information to affected groups as quickly as possible. We don't have the capability of keeping lists and saying you're first in line when we get vaccines. We will give that information out when we get the vaccine. I can tell you, for us at Grand Itasca, we are more than ready to give these out. We have space built. We have staff ready, like Kelly and many other people around the state. We're just waiting for the vaccine.
And I would echo that from a public health standpoint. We're receiving a record number of calls to our information line, and actually multiple of us are receiving these same phone calls, and we don't have a list right now, but when it happens, when we have the vaccine, we're ready, and actually have received the directive to be ready to administer now within 72 hours of receipt of a vaccine. That is what we are required to do in public health, and we'll do that. Any other questions? Okay, seeing none, thank you so much for joining us, and stay well and stay strong. Thank you.
UPM leads the integration of bio and forest industries. Our constant aim is to produce more with less. That's what Bio4 stands for. Paper is true Bio4 product made of renewable and recyclable raw material. It remains sustainable throughout its whole life cycle. UPM Bio4, beyond fossils.